There's another health emergency in the Rohingya refugee camps close to the Myanmar border. The Bangladeshi government health worker calls to families to come for urgent vaccination against diphtheria. UNICEF says at least 420 refugees are suspected of having contracted the highly infectious and potentially lethal respiratory disease. At least 6 people have reportedly died. More than 60% of the approximate 640,000 Rohingya refugees who have arrived here in recent months are children, and many of them are suffering from severe acute malnutrition, which weakens their immunity.
In
Myanmar, we didn't have any health care. If someone got sick, we had to take him to doctors a long way away, and it cost a lot of money.
Most Rohingya were never inoculated against diphtheria and other contagious diseases in Myanmar. Since the Myanmar government withdrew their citizenship 35 years ago, they had limited access to medical care. There are 50 diphtheria vaccination centres like this that have been set up across the camps. More than 250 people have been trained to give the injection over the last couple of days. The government and the UN are describing this anti-diphtheria drive now as a top priority. The government is working with the UN and international aid organisations to tackle the outbreak.
Definitely, crowded population have every chance to get the infection by the diphtheria or other infectious diseases. Yeah, this is the from medical side. This is true. But we have started our campaign as early as possible. So we should definitely contain within soon, hopefully.
Around 700,000 Rohingya refugees have been inoculated against cholera, and after an outbreak of measles, at least 350,000 refugees have been vaccinated against that contagious disease. Aid groups and the Bangladesh government were already struggling to meet the basic health needs of these people. A diphtheria outbreak has made that challenge even harder. Charles Stratford, Al Jazeera, Palankali refugee camp, Bangladesh.